So another question that comes up often is whether bipolar brains need more sleep. This is also an excellent question. And I think the answer here is also complicated. So sleep is really important to bipolar disorder. When you don't get enough sleep, you're more vulnerable to manic episodes. Changes in sleep duration, too long, too short, are symptomatic, are often seen during the symptomatic phases of bipolar disorder. So typically less sleep when you're experiencing mania, more sleep when you're depressed. So it's both a contributor to the causes of episodes and a manifestation of the episodes themselves. But the question about whether your brain needs more sleep, I think the way we think about this is in a nuanced way. I talk about the sort of Goldilocks principles of sleep, which means you don't want too much, you don't want too little, you want an amount that is just right, right? So typically human brains, whether your brain has bipolar disorder or some other kind of disorder, and there's nobody with no disorder, but just human brains need somewhere between 7 and 9 hours of sleep. So I think that is the sweet spot for virtually all of us. And I know that some people, both living with bipolar disorder and even some people without, some people who kind of run with like what we call a hyperthymic temperament, a little bit on the higher side, say, I'm great. I'm good with, 4 hours of sleep. The truth of the matter is when we do cognitive testing of people who are sleeping less than 7 hours a night, our reaction time, our cognition is worse. So even if you sort of think you do fine with like less than 7 hours of sleep, you probably don't. Similarly, if you oversleep, if you get too many hours of sleep, you tend to be groggy, slowed down, and sometimes can be at risk for developing depressive symptoms. And so, again, everybody's a little bit different, and I can't say that for you in particular, you need exactly this many hours of sleep, but a safe bet is somewhere between 7 and 9 hours. I will say that getting enough sleep can be really protective. So that's one thing that we can all do to help ourselves function better. Good quality sleep has been associated with better health outcomes in general, whether that's blood pressure, the effect risk for cardiac disease, but it also is associated with decreasing the risk of subsequent bipolar episodes. So protecting your brain by getting enough sleep, but not too much sleep, is the answer to the question of how much sleep does somebody with bipolar disorder need.